Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I am delighted to welcome an accomplished health tech entrepreneur from Nagpur, India, Mr. Omkar Nakade. Omkar, welcome to the show.
Thank you, Ashutosh. Good morning and pleasure to be on your show.
Thank you. Omkar is the co-founder and director of MEDNET Labs, which is a leading healthcare technology company specializing in health management information systems. So, Omkar, my first question is, tell me a little bit about your journey, um, and what was it in your personal experience from your mother's illness that shaped your vision for MEDNET Labs?
Thank you. So, me and my brother, Siddharth, we are born and brought up in Nagpur. We did our engineering from Nagpur University and we worked in IT company in Bombay
Hmm.
as our career started. And we got the opportunity to go to US. We joined um, American companies. I worked in IBM Global Services, Booz Allen Hamilton. So we had a, uh detailed career in IT. I did my MBA from Open University as well, as did Sid. So we had similar background.
Hmm.
Uh, in 2008, our parents were visiting us, and my mother was having cancer, breast cancer, and she started having pain in liver. So
Hmm.
uh, we thought, and there were a plethora of tests which we went through, and we approached all the best of the best oncologists and all the treatment.
Hmm.
During her treatment, she thought she wanted to come back home to Nagpur. So that was her wish, and we thought, okay, uh, we can do that. Parents moved back here. Me and Siddharth, we got involved in her treatment. We were shuttling back and forth, and eventually we moved back. We
Hmm.
decided to move back to Nagpur. But during that episode or that treatment,
Hmm.
realized the healthcare in Western countries, specifically in US, is so different compared to a tier two city in India at that time. This was
Yeah.
like in 2008, 2009,
Hmm.
2012. And coming from IT background, we thought we can contribute a little bit since
Hmm.
we're here, and we were encouraged by a lot of doctors, oncologists. So that was a very personal journey, and we believe through technology, healthcare delivery system can be improved. It can
Hmm.
be automated. So that was something triggered our thought process. It was not that health tech is something which is lucrative. It was through problem solving. We knew what was the problem. We experienced those things, and
Hmm.
we decided to address that in our own way.
Well said. And what was the initial vision behind the founding of MEDNET? And how has this evolved?
So we started with the clinical data. So uh, as of today, MedNet is a ERP system which touches each and every aspect. But when we started all these things, our primary focus was the clinical data, the pathology data, the prescriptions, the
Hmm.
discharge summaries, and all those things. Because a treatment in chronic illness like cancer, your historical data is of utmost relevance. What has
Right.
worked, what has not worked. So there's a lot of clinical decision making based on historical data. And if
Hmm.
it's not collated properly, your decision can go sideways because of lack of data, lack of proper information. So that was the first thing, that the clinical decision making should be more evidence based. It should
Hmm.
be coming with lot of information. All touch points should be there in front of you as a oncologist or any clinician for that
Right.
matter.
Hmm.
So that is how we started, and then slowly um, uh, people started asking for billing, procurement, other peripheral
Yeah.
goods as well. So
Hmm.
we ended up doing the entire thing for healthcare. As long as it was part of healthcare, we
Hmm.
didn't mind expanding this
Hmm.
scope.
Hmm. But tell me, Omkar, there are so many healthcare management systems. What makes MedNet unique and how are you different?
So yes, there are many health tech companies, hospital information system. I see that as a validity to what we are doing. It
Correct.
gives us things that, okay, what we are trying to achieve or what we are trying to solve. I
Hmm.
believe we are consistent with few other people who are also thinking in the same way. So
Hmm.
see it in that way. What differentiates us is uh, probably our two things. One is our understanding in the clinical aspect. Our EMR, electronic medical record, or EHR, electronic health record, is something that we have done sincere work,
Hmm.
hands out.
Hmm.
Um, the reason is we have spent countless hours with clinicians. We have gone through books. I'll give you one example. In oncology, the disease diagnosis is not only important, but
Hmm.
the staging is also important.
Hmm.
In terms of if it's a stage one, the treatment protocol would vary if it's stage three or stage four. So it is governed by AGCC, American Joint Commission for Cancer Center.
Hmm.
It's a huge book. It took us 8 months to understand and find out the nuances and
Hmm.
inculcate those things in our software. So,
Right.
this is one example where I believe we have a better detailed understanding of a clinical aspect. The second thing is we believe the execution is also very important.
Hmm.
You build a ship which is good to use, but unless it is being put to use properly
Hmm.
and work closely with the users, it will not be effective enough.
Hmm.
So our engagement level is much higher. So these are two specific things. Again, I will not say technology. We have one of the most modern technology and all those things,
Hmm.
but these are from an execution level, from a value point of view. These, I believe, would be the standout differentiators.
Hmm. Well said. Well said. And my next question is, how do you ensure that a lot of your solutions are really user friendly for the healthcare professionals and they may not necessarily be tech savvy?
This is again a very relevant question. It boils down to what I said in the
Hmm.
second point. In technology, we call something, there's a specialized field for this
Hmm.
user interface, UX.
Hmm.
And I, being part of IBM at
Hmm.
some point of time, I was exposed to this kind of thing. So, as engineers, we design certain things. Uh, Purely, our primary focus is the functionality.
Hmm.
Our aesthetics or user friendliness is something which comes in later on.
Hmm.
So I have learned during my training or my experience. It has given me a lot of insight as to how it can be used. Made sure that it should be user friendly.
Hmm.
I'll give you an example here.
Yeah.
Clinicians are they don't use a lot of keyboard.
Hmm.
They are using more of tabs and all those things. So
Correct.
our EMR module is tab centric. It's tablet friendly. It's you can use tablet and click and go everything.
Hmm.
If you compare a pharmacy user, those do not use mouse. Those
Hmm.
use tabs, keyboard. So it's tab control.
Hmm.
We understood each and every user properly, and we have designed the user interface in such a way that it's more tuned to his working.
Hmm.
So these are the examples, and
Hmm.
it's a very, very important question in terms of adaptability.
Right.
Yes.
Very interesting. You also have managed to expand MedNet to a client base across three continents. That's when I was reading about you. This is what I found. Uh, From a position where India alone is such a big market, and yet there are many, many more gaps, you've gone well beyond India. What have been some of the strategies that you have employed to take your product global?
So there were two specific reasons why we wanted to make sure that we are crossing boundaries and making it more of a global product.
Right.
First is there are a lot of international standards, and we wanted our product to be not only domestic centric, but what are the good features, and we wanted the best of all the worlds.
Mm.
So, for example, we are in US. We have presence in the US. We have presence in UAE as well.
Yeah.
And I'll give you a couple of examples here.
Mm.
We have, being in US, we had to have HIPAA standards, one
Mm.
of the most stringent laws on the
Yeah.
face of the earth in terms of data security, sensitivity.
Correct. Correct.
And Indian laws do not require that kind of high sensitivity as of now.
Mm.
We would catch up at some point of time. So we believed we are few steps ahead in terms of what is required in the
Mm.
domestic market. Being international, that comes with those kind of perks where all the best practices we are adopting.
Mm.
The second thing is it also diversifies. Again, with Western countries, even in Middle East, the conversion rate. So it makes monetarily a little better proposition
Mm.
to make it spread out in multiple geographies. Um, so these are the two factors, and
Interesting.
that has been, and we have employed a very specific strategy where we tie up with the local partner so that the product is delivered, but the local touch is always there.
Well said. The other question I wanted to get your thoughts on was that, you got a technology platform. And given the background of both you and your brother as tech people, technology is evolving every single day. New things are coming every day. How are you keeping MedNet contemporary? And how are you looking at integrating so much of this artificial intelligence and machine learning and so many other types of technologies coming in?
So very interesting thing. It's very fluid, as you rightly said.
Hmm.
Technology is something which is evolving, and the rapidity at which it would evolve would be 3x, 5x in
Correct.
coming days
Hmm.
compared to past 5 years or 10
Yeah.
years.
Hmm.
So it has to be a very delicate balance.
Hmm.
And I'll share my thought on those things. We need to be in terms of technology, just because it's a fancy technology, we don't want to adopt. Um, it should bring value.
Hmm.
So, machine learning, IoTs, AI are something that we have to be prepared, because I know how the wind is going in terms of healthcare or
Right.
disruptive things. Um, and my conjecture at some point of time is it's going to fundamentally change
Hmm.
the doctor and patient relation because of these kind of things.
Hmm.
But again, having said that, we have to go through certain level of metamorphosis as a product as well. We cannot be super focused on only the technology, but
Hmm.
it should be a delicate balance between the usage, what the technology brings as a value, compared to um, what our mature product looks like. So, in our 14 years of existence, I would say there has been two distinct metamorphoses, MedNet 2 and MedNet
Correct.
3. We have rolled out various things, which including uh, microservices and blockchain, all those things
Hmm.
with AI ML.
Hmm.
So a lot of smartness added in terms of adoption with integration with IoTs and all those
Hmm.
things.
Well said. A few minutes back, Omkar, you spoke about the need for data privacy when you were talking about this in the context of the HIPAA approvals. How do you address concerns regarding data privacy and security when it comes to handling sensitive medical records in India? Because our laws are still a little early.
Yes, yes, I agree on this because I happen to read and happen to compare
Hmm.
the domestic laws, the laws compared with Western countries, specifically US
Hmm.
and Dubai, UAE. So there are NABID standards, and Ayushman Bharat is also, we have worked very closely with NHA,
Hmm.
National Health Authority. So I believe these are very crucial things. And I'll share what the vision with the NHA or Ayushman Bharat is.
Hmm.
If it gets executed, we, in terms of data security, privacy,
Hmm.
we would be at par or a little ahead of the standards which are
Right.
there in
Yes.
Western countries.
Hmm.
So I'll give you an example where with data encryption and
Hmm.
control of data authentication by the patient,
Hmm.
data can be shared seamlessly with the sharing of OTP. It's
Hmm.
a very simple solution, but it takes care of all the required protocols which are
Hmm.
required.
Hmm.
So I think simplicity in terms of strategy is
Hmm.
something I would give a lot of credit to Ayushman Bharat team in terms of getting these things executed.
Hmm. And whether it's Ayushman Bharat or any of the other government platforms, how will those regulations manage data security in the very large private market?
So the way they have rolled out these data security guidelines, again, these are guidelines and
Hmm.
everyone has to adapt.
Right.
Now the good thing is they are giving brownie points for adoption
Hmm.
of these things. I mean,
Hmm.
not only monetary adoption, but they have given more flexibility in terms of you can charge the patient on a little premium basis and
Hmm.
all those things.
Hmm.
NABH is also a digital version. There's a digital NABH which is coming up, which might
Hmm.
give better outcomes and more flexibility to the hospital. So
Hmm.
uh, the guidelines and the strategies are amazing.
Hmm.
I would say those are definitely going in the right direction, which is required because, again, uh, clinical data can be abused.
Hmm.
Uh, there are, I've heard a lot of stories where these things, if not monitored and secured properly, can be abused to a very high degree.
Absolutely.
So this becomes one of the most important things. We
Hmm.
think about the features, the flexibility to the
Hmm.
patients and healthcare delivery system, but right, very rightly so. The data security, the clinical data, the sensitive data has to be of paramount importance here.
Well
And
said.
there are a lot of guidelines indicating those things.
Hmm. Amazing. So, Omkar, I have time for two more questions. My next question is, what are some of the innovations in your field that you are excited about, and how are you planning to integrate them into MedNet?
So yes, there are very exciting and disruptive things which are coming up, and I'll
Hmm.
share one small story.
Hmm.
Um, there's a IoT device. So let me give you a background. In
Hmm.
myocardial infarction, which is called heart attack,
Yeah.
um, the heart secretes an enzyme called troponin,
Hmm.
and it gets mixed up in the blood, and it's an invasive test. You draw blood and you check if the troponin level is there. That means the patient has received has
Hmm.
gone through a heart attack. So this is an invasive process. It takes about 45 minutes to 60 minutes
Hmm.
to detect because it's an invasive process. You take out blood and all those things have
Right.
to be there.
Hmm.
Now there's a IoT. One of my friends based out of US, the company name is RC. They have developed a IoT device which goes on the wrist and it checks the protein level in the blood through infrared light, non-invasive way, and the results are out in about 3 minutes.
Hmm.
So a patient who is having chest pain or some sweating symptoms of myocardial infarction,
Hmm.
you within 3 minutes or so, you are getting the information that yes, this is a heart attack, so that you can start the treatment. It's a very important thing. So these
Right.
are the innovative things which are coming up, and this is one thing. The second thing is AI/ML, and my
Mm.
architecture in the future is, at some point of time, if you categorize simple level diseases, mid
Yeah.
level, and high level complex surgeries,
Mm.
interventions, the simple level would be done very easily by something like IBM Watson, some
Mm.
smart machines
Mm.
will be able to give you based on your symptoms,
Yeah.
your blood works. So I would see the interaction or the skill level or the requirement of a clinician or a doctor would be more focused on surgeries or more
Mm.
complex
Mm.
things. Again, these are few places where things would be really, really innovative, and technology plays a very, very important role.
Amazing. And my last question to you, Omkar, and this is for you personally, given the fact that you were, in such large, major global tech companies and you became a startup and now have built that into such an amazing organization, as you look back at your journey, what have been some of the key lessons you have learned that have shaped your leadership, your approach to business and leadership?
So it's a very interesting thing, and I believe I'm the first generation entrepreneur. We in our family we never had
Yeah.
experience of that, so
Mm.
it has been a big learning curve for us.
Mm.
Um, Again, what we believed, what we can do from a technology point of view, is something we can do good.
Mm.
I believe in our execution, but um guiding a ship is a totally different ball game.
Mm.
Running a company and all those things, it comes with a lot of peripheral things,
Mm.
the HR challenges, the
Correct.
monitoring challenges, and all those things. But it has been exhilarating. I mean, you have been an entrepreneur, you have been
Mm.
serious entrepreneur, you know. So a regular 9 to 5 job is very mundane. I
Correct.
cannot imagine myself going back to that kind of thing.
Mm.
uh, and you have 20 different moving parts when
Mm.
you're running a ship or
Mm.
startup. So it has to be done properly. You need to have a good crew, good team to execute those things. You
Mm.
cannot do everything on yourself. So we have learned those things the hard way. Probably we were doing certain things on our own, but as you scale up, you need to have good guidelines, good processes in
Mm.
place,
Mm.
good team members to execute those things.
Well said. And on that note, Omkar, I just want to say thank you so much for speaking to me about your own journey. It's amazing how both you and your brother were inspired by the challenges you faced with your mother's health and have built such an amazing company, MEDNET. We managed to speak a lot about MEDNET. We managed to talk about how important it is for it to be user friendly. You also told us about the emerging technologies, about the importance of data privacy and security, and how Indian laws are coming in, and once implemented, they will probably be amongst the best in the world. You also told me a little bit about some of the new innovations that are coming, including the wearable devices and IoT, which is going to make a big difference. Thank you for speaking to me and good luck to you.
Thank you, Ashutosh. Have a good one.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the brand called You.